So Malawi has been battling with cholera since last year in February. All the 29 districts have been affected. We've seen a lot of deaths. Over 1,000 people have died due to cholera. And as Malawi Red Cross Society, we started responding together with the Malawi government from the onset of the disease. Our focus has been to look at issues of risk, communication and community engagement, where through our volunteers we were able to build their capacity to train them on cholera-related issues so that they are able to at least provide the right information, so raising awareness on cholera itself, but also supporting the government to mobilize people to receive oral cholera vaccine, among other things. The volunteers have been moving door to door to just encourage people to practice hygiene behaviors, to drink safe water, but also providing port-to-port coordination. In terms of case management, we've been looking at interventions at community as well as at a health facility level. So at the health facility mainly, we've been providing things like the tents to support an establishment of cholera treatment units, but also we've been providing several supplies, be it medical or non-medical. Our volunteers have also been supporting in terms of sanitizing the environment. At community level, we've also been doing case management interventions. For instance, we've been looking at establishing oral rehydration points. So the ORPs have been very vital in as far as helping the government to manage the cases at community level is concerned. What we call emergency response unit that came from Switzerland to just support the national society in setting up these ORPs. So one of the contributing factors to the current cholera cases is inadequate safe water sources. And as Malawi Red Cross Society, with our partners, we've been able to provide the safe water through drilling of boreholes in such places as the Tukombo area, where the cases were just so huge at the very beginning. We've also been providing chlorine through our volunteers. So the volunteers have been moving from door to door, trying to chlorinate the water so that the communities are getting safe water sources. These volunteers are residing right in the communities where the cases are being recorded, so they understand the communities better. There are issues of misinformation and not having adequate information, issues of culture. So the volunteers are being given the right messaging on cholera. So in terms of how it is spread, how it can be prevented, what could be the signs of cholera, and how to take care of cholera suspects, and also how to report on the same. Malawi Red Cross Society has also been doing cross-border activities. So our volunteers did set several hand-washing points just to encourage the people to, be able to wash their hands with soap. In the districts that we've been intervening, at least we are seeing cases going down. So we can attribute our interventions to say, at least we are making a contribution towards that. We need to continue engaging, we need to continue with the interventions that we are doing. Each and every district has to be reached with cholera prevention and control interventions. So given adequate resources, we believe we can do more because the capacity is there, the willingness is there, but the resources is what we need.